everyone. I'm Dr. Ashwini, Fetal Medicine Consultant at WMN. Did you know that World Down Syndrome Day is observed every year on March 21st? That is the 21st day of the third month of the year. This date was chosen to signify the cause of Down syndrome, where 21st chromosome is present as 3 copies instead of the usual 2. Our body is made up of millions of cells. Cells contain genetic material which define how we look and how the body functions. There are 23 pairs of chromosomes in every cell. Individuals with Down syndrome have an extra copy of 21st chromosome, that is 3 copies, and a total of 47 chromosomes. Individuals with Down syndrome can have structural problems in various body systems and can have learning disabilities. It's a day to recognize diversity and to promote inclusion and acceptance of people with Down syndrome in our society. In India, Down syndrome occurs in approximately 1 in every 800 births. It's important to note that the incidence of Down syndrome increases with maternal age. In the past, the only way to diagnose Down syndrome was after the baby was born. But now, thanks to the advances in the field of fetal medicine, it is possible to diagnose Down syndrome during pregnancy. The number of chromosomes in the baby in the womb can be determined by taking a fluid sample around the baby and testing the cells for the presence of extra copy of 21st chromosome. The procedure is done by inserting a thin needle into the womb cavity and collecting the fluid around the baby, and this procedure is called amniocentesis. However, this test cannot be done on all pregnant women as this procedure carries a small risk of miscarriage. This is the reason screening for chromosomal abnormalities like the Down syndrome have been developed. Screening for Down syndrome is performed between 11 weeks to 13 weeks and 6 days of pregnancy. The test involves a scan and a blood test called the double marker test, performed on the mother. The scan is performed to look for markers of Down syndrome, and these are increased nuchal translucency, which is the fluid thickness at the back of the neck of the baby, and absent nasal bone, a bone found at the root of the nose. The risk assessment from the scan is combined with the double marker blood test report to obtain a combined risk, which gives us an estimate of likelihood of baby having Down syndrome. The final risk is categorized as high risk or low risk. For low risk women, the chance of baby having Down syndrome is very less and further confirmatory tests are not offered. For women with high risk, the baby's chance of having Down syndrome is high, and for these women, further confirmatory tests like the amniocentesis is offered. Another way to screen for Down syndrome is through non-invasive prenatal testing or NIPT. This involves taking a sample of the mother's blood and testing for the presence of fetal DNA. Early detection of Down syndrome through these tests can provide parents with information to make informed decisions about their pregnancy and plan for the care of the child. On this World Down Syndrome Day, let us continue to raise awareness and support those with Down syndrome and their families. It's important to remember that diagnosis of Down syndrome does not define a person. With the right support, people with Down syndrome can achieve a functional life. And let's remember that every person, no matter their abilities, deserve love and respect. Thank you for watching.